Are bleeding gums and COVID-19 related? Hi, I'm Dr. Debbie Osment, and from my research and personal experience, I absolutely believe they are. First, I'll start with personal experience. I was a private practice dentist for 34 years in a little personalized practice. I love people, so I really liked it going at sort of a slow pace so that I could talk to people and get to know people, hear about their dogs, hear about their vacations, hear about their dreams and hopes and fears. And through that, I observed a lot about people's health trajectories. And because of having the luxury of knowing their health and looking in their mouth, I got to see correlations. Well, that ignited my desire to go back to school. I went back and got lots of certifications, lots of letters behind my name, including Mayo Clinic Wellness Coaching and a master's from a medical school. Well, through all of that research and through my master's thesis, I researched the impact of bleeding gums or gum disease and other chronic health conditions. Consequently, I did a TED Talk on that topic. So if you have time, watch my 14-minute TED Talk. It's called The Forgotten Orifice. Well, bleeding gums are a sign of chronic inflammation. All inflammation is not bad. Acute inflammation is designed to help us and heal us. But chronic inflammation is sort of like having a pot of water on simmer. And simmer is taking up a lot of energy. And in the case of diseases, the more simmer you have, the higher the temperature goes, the more chance of that chronic inflammation overflowing and going on to full-blown disease. Well, I've learned, and the research worldwide supports it, that bleeding gums impacts all kinds of diseases such as type 2 diabetes, obesity, heart disease, memory loss, rheumatoid arthritis, on and on and on. That's just a few pregnancy complications. That's a big one. And the good news is that bleeding gums are something you can do, that you have some control over. You can do something about bleeding gums. The problem is that we've just not connected the mouth to the body. So consequently, I sold my dental practice to a wonderful dentist. Now I'm not retired. Now I exclusively see patients who have chronic inflammatory diseases or challenges, patients who self-refer but are mostly referred by their physician. Now for these patients, I do a salivary test to see exactly what bugs, what microorganisms are in their mouth that are affecting these diseases. And it's absolutely fascinating. I usually have before blood tests and after blood tests, so I get to see how just some simple therapy can decrease the chronic inflammation. Well, so that's my research as well as my personal observation, but there's a lot more research. There was a recent study in the Journal of the American Medical Association published in late April, and it was an observational study of 5,700 people, and they looked at the people who had either heart disease, were obese, or had type 2 diabetes. And actually it should have been hypertension, obesity, and type 2 diabetes. Hypertension is a piece of heart disease. So they looked at these people and they found that only of the 5,700, only 6% didn't have one of those conditions. But interestingly, they found that 88% of the people admitted to the hospital had 2 or more of those conditions. Now that's news you can use, because you can go to your dentist and get this inflammation decreased. When you get your teeth cleaned and all of that gunk comes off, that decreases inflammation, and on a daily basis, you want to make sure that you have no bleeding. Bleeding is not good. It might be normal for you, but it's not good. You know, normal gets really overrated. I mean, credit card debt is normal. Gossip is normal. So many things that are not good are normal. So normal is not the point. We want to look for optimal and go to the dentist. It's going to help decrease that simmer going on in your body. It's going to help any other chronic inflammatory diseases you have, and you're going to feel better, and you're going to have better breath. hey, can't lose. So thanks for joining me. Start somewhere. Do what you can do. All disease is not preventable, but we want to use our brains. We want to just do simple procedures so that we change that health trajectory and get to maximize life. Thank you. Oh, P.S. This last week I talked about my wild experience at the eye doctor when I passed out during an eye exam because I was letting my brain go wild. You know, the doctor said I had a torn retina, and suddenly my brain took me to, you know, living on a vent, homeless, penniless, you know, just horrible, passed out. When I woke up, Dr. Andrew Hogue and my husband Mike were standing over me, revived me. I was fine. Dr. Hogue spent his lunch hour doing laser treatment on me, and all is well. So thanks for asking, those of you. I feel like Paul Harvey telling you the rest of the story. Thanks. See you next week.